Hi, thanks for joining me today. I'm going to give you a brief overview of the pillars of global health and focus on the ethics module in our set of modules. My name is Dr. Jenny Saman, and I serve as a senior medical education consultant with Child and Family Health International. The Pillars modules are CFHI's newest educational tool. They are completely virtual and therefore very flexible for institutions and students, as well as healthcare professionals in general, to use. Currently, we have 7 of them. From left to right, they're global health definitions and discourses, planetary and One Health, and global health ethics, which I'll focus on in just a bit. Above each one, you'll note that I have placed some of the sustainable development goals that these modules are helping to advance. The other 4 that currently exist are cross-cultural effectiveness, social determinants of health, diversity, equity, and health disparities, and global burden of disease. We're really pleased to be adding an 8th one sometime in the next few months, and that one will be health systems. But let's go ahead and focus on what would you expect to find in the global health ethics module? Well, we know that at its core, global health is global health ethics. And the question really is, how can we ensure that good intentions and a desire to help don't actually lead to harmful actions in global health? And how do we even know if someone is being harmed? Well, we address a variety of topics in this module, including the concept of the savior complex that is rooted in the colonial legacy of helping the poor and the underprivileged. That includes the assumption that the community that the global health education program is going to take place in is an environment that doesn't have its own indigenous knowledge and that it needs saving. It doesn't have leadership or agency. And it is really essential that we dispel these notions and that we do not assume when we enter communities with which we are unfamiliar that we are the experts. Also included in this ethics module are the results of a survey that was conducted in 38 countries where host communities were asked about the experience of interacting with visiting students and scholars, teaching them, working alongside of them, being preceptors to them. And this is a voice that is often unheard and unrecognized, though it is essential to understanding and appreciating global health in another context. As with the other modules, thoughtful articles are embedded, and really we're encouraging the learner to reflect on their own biases and assumptions as a starting point. And last but not least, we've included a very important topic, and that is the ethics of photography. We know that most learners now have a cell phone in hand, which means they have a camera and easy access to social media. In this component, we're really helping students to understand what patient autonomy looks like, the ethics of protecting the vulnerable, and setting expectations and understanding of the power distance dynamics that occur even when you obtain informed consent. So really, in summary, our goal for students and faculty members is for them to enter a new cultural setting with humility, respect, introspection, solidarity, and social justice. I hope that you will explore this further and that you'll be ready to have a conversation with me about how you could incorporate pillars of global health into your learning environment. Thank you.